All elections are important. We know in our bones this one is more consequential.
And this is the most important election in the history of our country.
From Bloomberg QuickTake, I'm Madison Mills, and on today's episode of The Most Important Election Ever, we're digging into how COVID-19 could impact the presidential election. We'll also talk through how unemployment and millions of uninsured Americans have revealed cracks in our healthcare system that have been there for years or centuries. And joining us to unpack all of this and more is Riley Griffin, a Bloomberg News reporter, and Dr. Lisa Cooper from the Johns Hopkins Bloomberg School of Public Health. Thank you both so much for joining us. Riley, I want to dig right into it because we don't have a ton of time. And starting with you, can you talk about how the pandemic might influence the election? I know you've done a lot of reporting on COVID voters and their thoughts.
Absolutely. We dove into this very question in a recent Business Week issue that explored different voter sentiment. The task I had as a pharmaceutical reporter and broader healthcare reporter was to gauge that. What will this mean? How will the Trump administration's handling of the pandemic actually impact voter sentiment? You know, we looked at polling and research firms and actually found that though the pandemic initially boosted Trump's approval rating, as cases and deaths mount, we recently reached 200,000 deaths here in the US, his approval rating has continued to fall. And in particular, it's mobilized two cohorts of voters. One, Republicans for whom the handling of the pandemic was really the last straw in their appreciation of the Trump administration. And also what we call low propensity Democrats and independent voters who may not have voted in the 2016 election and have been disillusioned by the candidates that have been presented to them in recent years, but now feel like they must engage politically in different ways. And so those are the two cohorts that we're looking to as a news organization, but also those who I had the opportunity to speak with for that this week. Some of those were Republicans who have never before voted for a Democrat, and others were Democrats and independents who didn't vote for Hillary Clinton last October. I think what was so jarring, Madison, was that all these Corona voters came to their understanding of this 2020 US presidential election for different reasons. You had mothers who were frustrated to be paying college tuition fees, kids who were taking classes from home. You had family members who had lost loved ones due to COVID. The handling of the coronavirus pandemic may affect people in different ways, but ultimately, for these two cohorts, it's trending bad for President Donald Trump.
And Riley, you mentioned the impact of some of the economic factors that have been really pronounced during COVID. So going to you, Dr. Cooper, you've done a lot of work in health disparities in the US. Can you just talk through what some of those disparities look like and how they might influence voters' decisions on Election Day?
Right. Well, we've seen people from communities of color, African Americans, Hispanics, also Native Americans, who have really been impacted by COVID-19 disproportionately. They've had higher rates of infections, higher rates of hospitalizations and deaths, up to 3 times higher than whites. So we know that those groups have been really experiencing a lot of illness. We also know that it's had a very harsh impact on the economics. A lot of frontline workers are overrepresented among ethnic minorities. People of color, people have been in jobs that don't pay benefits oftentimes, and often are hourly workers and have lost their jobs. So it's been financial as well as a health impact. And then you add to that sort of all the racial unrest and the violence perpetrated against people of color by the police at this time. And it's really had, I would say, an effect also on the mental health of these groups.
And Dr. Cooper, sticking with you, when you talk about some of these issues, it does make me think about vaccine hesitancy. Can you talk through how these communities specifically might be impacted by that?
Yeah, so a lot of these communities have experienced racism and discrimination for a long time. There's a history of health care inequities, so people have experienced lack of opportunities to access and obtain high quality health care. We know that there are stories such as the Tuskegee syphilis experiment that many people are aware of, where African-American men were untreated for syphilis for many years, even after the treatment penicillin became available. In that study, we know about the story of Mrs. Henrietta Lacks, who had her cells taken without her consent or knowledge, and her family just learned about it many decades later. So we know that there's a reason why African Americans and other people of color may mistrust the healthcare system as well as mistrust science. And so it's understandable that people might be concerned that they are going to be either experimented upon or there's going to be some harm that will come to them through this vaccine, and also concerns that people, the broader scientific community or politicians might be using this to their own benefit. And so, scientists and public health professionals are going to have to really work hard to communicate with those communities, use trusted members of those communities to really communicate about the safety of the vaccine, the tests that are being done to assure that people will be protected against any harm from taking it, and that it will be made available and effective for everyone and not just for a certain group of people.
And going to you for a moment, Riley, can you talk about what the federal government is planning to do or could do to kind of address some of those concerns that Dr. Cooper explained?
Absolutely. Well, to take you back a moment, we've got about 190 different experimental vaccines in development across the globe, according to the World Health Organization, 40 of which are in trials, and 4 here in the U.S. have particularly important as they are reaching a point in their late stage studies that may soon read out data. Some of those names may be familiar to our listeners. That includes Moderna, that includes AstraZeneca and Oxford, that includes Pfizer and BioNTech, and more recently Johnson & Johnson. And the US government has put together a cohort called Operation Warp Speed that is intended to aid those development efforts, manufacturing, distribution, and so forth. But that typically take years to develop, and we're trying to do this in a matter of months, and that has caused quite a bit of concern. Simultaneously, you've had a number of remarks within the Trump administration that have been fairly contentious. Trump more recently called the FDA as partaking in deep state activity to slow down the approval process for a vaccine. So there's been a lot of heightened political debate surrounding the vaccine itself, and that's fairly unprecedented to talk about drugs and vaccines in this political context, especially in hopes of seeing a vaccine come to market for the election, around the time of the election. What the government is doing to alleviate some vaccine hesitancy, as we've heard from, for example, Surgeon General Jerome Adams, is turn to celebrities and trusted community officials. We will only approve a vaccine if it's safe and effective, and that we're not cutting corners here. So we might be expediting the process, that U.S. regulators will only approve, push forward a vaccine if it confirms safety and efficacy.
And I suppose this is a question for both of you, but how do all of these concerns and just the rush surrounding the vaccine impact the voter on election day? It's literally called Operation Warp Speed, like you said, Riley. So I'm wondering, in the minds of voters who are already experiencing the vaccine hesitancy that you mentioned, Dr. Cooper, how does that influence their vote?
I personally think a lot of this is going to come down to what data we see read out this coming October. Pfizer and its partner BioNTech have said that they could have late stage data that could point to whether or not they should have emergency use authorization by the end of the month. And that is soon. And we will know, potentially whether the company could get an emergency use authorization by that point. But it's also highly possible that we don't see a vaccine come before election day. Right. And many health experts have said possible that some of these concerns are alleviated if we don't actually see a vaccine come to market before the election, that folks might not feel as though the political dynamics are as involved if the approval comes further down the line.
Dr. Cooper, do you have anything to add to that?
Sure. Yeah, I actually have been pretty involved in some of the work that's going on with the vaccine development and scientific monitoring of the safety of these studies. And to be honest with you, I don't really see a vaccine being available before the election, just because even though we're enrolling patients very rapidly, there are concerns about making sure we have adequate numbers of patients in different age groups, for example, and in different racial and ethnic groups, and a good balance of men and women, people with certain chronic conditions. We want to enroll people who are at higher risk for COVID-19 because we think they are the ones that would be most likely to benefit the most from the vaccine. And so, I think that is going to take several more weeks, if not months, because we really do have to look very carefully for any kinds of adverse events that might happen, things that might indicate that that the vaccine could be not safe for certain groups of people. And so scientists are being very careful about this. On the one hand, we know it's important to release the vaccine, but we know it's even more important to get it right. So honestly, even though it's warp speed and a lot of the companies are moving very rapidly, there are a lot of safety mechanisms in place. And the NIH has also launched a new initiative called the Community Engagement Alliance Against COVID-19. And that is an effort that will be across the country. Several states that are being hard hit by COVID-19 right now have been targeted to be sites where there will be extensive efforts to engage with community organizations, community groups, community leaders from communities of color to better inform them about the vaccine and to, basically engage them more in the research.
Dr. Cooper, staying with you, can you just tell us a bit about, we've talked about vaccines, but also treatments, and we've seen some federal emergency use authorizations issued. Should voters be concerned about those treatments getting pushed forward too quickly as well?
Well, I'd say scientists are not politicians, and we are not willing to put our integrity on the line because of any political agenda. So I would say that the public should feel comfortable and confident. Of course, everyone needs to be well informed, ask as many questions as you need to, speak with your primary care or your other physicians to get their opinions as well. But we, as from the scientific community, I can say, are not rushing towards anything. We are working very hard, and many of these studies have been in the works for many years, similar studies, and we're using methods that have been used in other vaccine trials and other drug trials. For example, we know that remdesivir was a drug that was used to try to combat Ebola, and now that's a drug that has been shown to be safe. So now it's being tested to see whether it'll be effective against COVID-19. And we know about the convalescent serum trials as well. So I don't think that people should be overly worried. Scientists are not going to rush this. We don't have any other agenda other than to get this right and to do it in a way that is safe for our patients and for our communities.
And Riley, hopping over to you, what are some solutions that the Trump administration is presenting beyond a vaccine and these authorizations we've talked about that he's trying to push forward to influence the healthcare system before November 3rd and hopefully get voters on his side for the election?
Before pivoting to that question, I do want to add to what Dr. Cooper articulated so well, which is not only are scientists ensuring that will only cross finish line if it proves ineffective, but vaccine makers themselves have made assurance that they're not going to present data unless they feel fully confident in that data. And that's a really important point. You're not only getting assurances that are hoping to bolster trust in communities, especially communities of color, from scientists and health authorities, but you're also getting them from the pharmaceutical industry as well. As for what Trump is trying to do with his broader healthcare agenda, if you turn back to July, he put in place 4 different executive orders aimed at lowering drug costs. Some of these are still in the rulemaking stage and not necessarily gone into effect. We haven't seen patients, for example, reap the benefits of out-of-pocket costs. But that would certainly be a next step should he be elected, would be furthering those executive orders. Something we saw a bit more recently was Trump sign an order that would just $200 discount cards would be sent to 33 million American seniors to help them with their out-of-pocket costs. We don't quite yet know where the funding for that is coming from entirely. The Trump administration says the cards will go out within weeks, possibly before the election, but not all before the election. And so some of these other points on drug pricing writ large, not just COVID-19 vaccines and therapeutics, are also going to come in.
And Dr. Cooper, I'm curious from a healthcare perspective, what do you or healthcare professionals more broadly wish that both Biden and Trump would include in their healthcare plans to keep Americans healthy?
Right. Well, my hope is that the Affordable Care Act will be preserved. I think that taking that away will strip away so many people of health insurance coverage, particularly those who have pre-existing conditions. So I would really like to see the Affordable Care Act not get stripped away. I also like the idea that Joe Biden has mentioned including a public option in his plan. I think that would make healthcare more affordable for many people who have incurred higher premiums because of, the lack of the individual mandate being enforced. And I know that is something that's now being sort of looked at, by our current administration is trying to sort of strip away some of particularly the individual mandate piece, which is what makes the plan work. Essentially, if everyone sort of pays into it and gets coverage, then that provides the support, for people who actually can't afford to pay for health insurance themselves. And it allows the states to be able to expand Medicaid. So I would really like to see the Affordable Care Act stay in place. I would like to see a public option so that people have a more affordable options. And I'd like to see the expansion of Medicaid and as well as, support to continue to go to community health centers and to primary care, prevention and public health efforts.
And a final question for both of you before we wrap is just, why is this such an important election? Why do you feel that this election is potentially the most important election ever?
Oh, so I guess you want me to go first. Well, I mean, I think this is so important. I think health is, a basic human right. And right now, our health is standing in the way of everything in this country. Our economy has virtually, been stopped because of this pandemic. I think we need a very strong focus on our public health infrastructure and protecting our basic social services that people need in times of crisis. And I think that's the important role that government plays. And I think this is a time for people to really look at policymakers who will support policies that, lift everyone up, that give everyone opportunities to have health, to have a good job, to be able to afford a good education and childcare. And I think that, we need to really look carefully at who is supporting which policies and not just what they're saying or promising, but where are the investments really going? And are the actions actually following what the words are? So I think it's more important than ever because this is the largest crisis that we have faced probably in, this is first of all, the largest pandemic in 100 years. And we've got now a whole series of racial, tensions and economic problems. We have this crisis is a global crisis, and we are no longer in a position to be a leader because of how poorly we have handled this.
To follow on Dr. Cooper's remarks, there's nothing more personal to the American voter than their health. Drug policy impacts every single one of us. And so this was important beforehand, but now we are in the greatest health crisis of our lifetime. And so I think, this is not something that has an end date in your life. Even with a vaccine coming to market, how long will immunity last? How will people get affordable and accessible access to those vaccines and therapeutics? What does this mean for economic policy to come and deficit to come? It touches every part of our society. And with 200,000 deaths now having mounted in the United States, I think people are going to want to know what comes. We've got our first debate tonight. And Joe Biden will be speaking with one another and to the American people laying out their healthcare agendas. So let's be watching tonight. Let's hear those promises, those claims, those remarks, the reflections on the pandemic are, and make sure we're following it as we.
Dr. Cooper and Riley Griffin, thank you so much for joining us and making the time this morning. And for all of you watching, you can continue to follow our coverage on COVID-19 and the election on all social platforms at Bloomberg QuickTake. And thank you so much for joining us today.
Thank you.
Thank you.